we are always looking for an established agent which may be able to prevent this coronavirus infection, because development of a new agent usually takes 12 to 18 months.
Right.
And therefore, while it's too premature and early to say whether this indirect evidence will translate into prevention
Right.
of coronavirus infections, trials have already started. In fact, 6 trials have already started of BCG vaccination being given to corona health workers, or health workers taking care of corona patients, and in patients above the age of 60, to see whether it actually prevents coronavirus infections or actually decreases the severity of coronavirus infections. So I think we're looking at another exciting perhaps area, perhaps another drug which is already available to us and we have experience of using it. And these trials over the next 4 to 6 weeks, so these are not long trials, in 4 to 6 weeks they will be able to tell us whether these drugs can actually prevent coronavirus infection or decrease the severity of coronavirus infection.
One of the effects of BCG, apart from its protective effect on tuberculosis, prevention of tuberculosis, is its basic increase in the immunity, the innate immunity of a human being, of a person who gets this. And this increase in the immunity actually enables the person who's been inoculated to fight infections. And it has been known, it has been seen that it has it increases the immunity even for patients with virus infections, for bacterial infections, and this is actually what is being touted as something which is going to increase the immunity against the COVID-19 onslaught as of now. There is no definite evidence. There are studies. There is a study which is started in Melbourne in Australia, which is recruiting over 1,000 patients, 1,000 people, basically health workers who are working in a hospital in Melbourne, who have been injected with the BCG vaccine, and the results will be known in about 3 to 4 months, when we will be able to identify whether that is indeed helpful or not. I think within the next 3 to 4 months, they will have some evidence which will probably tell us that the BCG is indeed protective and it is actually supplementing our innate immunity and preventing the intensity of COVID-19. It's not that it's going to prevent you from the infection, it is hopefully going to reduce the intensity, which means that people, whoever suffer, will not have very severe symptoms and the severe disease.